up here, huh?
Yes, sir.
Good afternoon to everyone. I'm delighted to be here in Mountain Home for our daily COVID-19 update, joined by Dr. Nate Smith, our Secretary of Health, as well as Dr. Jose Romero, who's joined us for this trip as well. And I want to express appreciation to ASU Mountain Home for the mask that they've made for this occasion. It's also great to be on a wonderful, beautiful campus of Arkansas State University at Mountain Home. As is our custom, as we come out of Little Rock and go to different parts of the state, I like to meet with representatives of different industries and but also education and healthcare. And so we've had a previous meeting talking about the status of the healthcare here, the business climate, the impact of COVID-19, learning about how school's going to be handled next year, taking notes as to how we can do better from a state perspective. So very grateful for the comments that they brought. Now, as Dr. Smith has noted, Baxter County has such a few number of active cases. And so the question is, well, why do you come to a part of the state that has few active cases? Well, the answer is to say you're doing something good, maybe there's something we can learn from you. But secondly, we know from experience that this coronavirus has swept across the state at different times and in different stages. And so, as everyone noted in our pre-meeting, that Baxter County and Boone County is not immune from an increase in cases in the future, and it depends upon our actions, it depends upon how seriously we take this. I do want to note our legislative delegation that's here and participating, and I'm thankful for they got to hear these comments as well. And so let me go through the cases. We'll do it from a statewide perspective, then we'll look at the Northwest region. Hopefully there'll be some things that are of interest to you. Yesterday, we had 16,083 cases in Arkansas. We've had an increase of 595 cases over the last 24 hours. That brings us to 16,678 cases. Of those 595 new cases, 212 were in corrections, which includes a significant number in a county jail as well as in a prison facility, and so the community cases were 383. In terms of hospitalizations, we've had an increase of 11. That brings us to 248. In terms of the deaths of Arkansans because of COVID-19, we've had an increase of 10. That brings us to 237. These are challenging numbers that you see that continue to challenge our state, that we have to continue to work hard to address, and we continue to do that. Part of that strategy is our testing. And as you know, yesterday we met our statewide goal for testing of 120,000 tests during the month of June. We've done that. We continue to test. The last 24 hours we conducted 5,344 tests. Now, if we go to the graphics here, and we got a number of them, so I'll go through them quickly, but we've got a lot of ground to cover. And this is a statewide number of new COVID cases. You can see the height where it was over 700. We have reduced that, even though it's a high number today. If you look at the community cases, that actually is a good progression. You go to the rolling average, you can see that you've got an uptick because of the cases today. The 7-day rolling average represented by the orange. And then the next one. These are the number of active community cases that excludes the corrections. And you can see that they are continuing to go up, although we hope they will be flat. And the next one, the number of currently hospitalized COVID patients. a key indicator, something we watch very closely, and it's at a new high of 250, even though we did dip down yesterday. So we'll continue to watch that. And now we can go to the Northwest region, and you can see the counties that are listed in the Northwest region. And even though Baxter County is in the 4th Congressional District in terms of public health regions, you're in the Northwest region. But you can see Baxter County had 14 cases on June 14th, and you have not had any increase, so you're still at 14. And so that's 0% growth. So hats off to Baxter County. If you go down to Boone County, you see they had an increase of 2 cases. But then, of course, you look at Benton County, a 32% increase. Carroll County, going across the northern part, that's a 57% increase, even though the numbers are still low. You look at Crawford County, a 62% increase. Johnson County, a 52% increase. Small numbers, but significant growth, 88 to 134. You look at Polk County, down in the River Valley, 25% increase. Sebastian County, 52% increase. And Washington County, a 28% increase. And so you can see a number of areas that we need to pay close attention to across the state. And of course, we don't want Baxter County to be in one of those growth areas. If you go to the next slide, and this is again just showing the growth rate in a percentage way, just by bars, so it's really the same thing we covered before, but you can see here the top growth is Crawford County, the second one is Carroll County, and then Sebastian County. And so we talk a lot about Benton and Washington County because the numbers are high. They have a high population there. Percent-wise, it's still high, but we see some other growth areas as well. And this is the growth rate by public health region. And so you see what I've just recited in the Northwest region of the state, that on average is a 31 or 32% growth rate. But you look at the other areas, the next one is Southwest, that you've had a couple prison facilities in that area, as well as Sevier County with a poultry industry outbreak there. Then Central, you see the growth rate, Southeast, and then Northeast. And then you go to the next slide, and this is the 7-day rolling average of new cases in the Northwest region. And even though we've had that growth that you saw in percentage-wise, you can see that on the rolling average, it's starting to flatten out. We'll see if that continues. The number of currently hospitalized patients, you can see that has declined a little bit, and this is a broad area for a Northwest region. And then if you go to the next, the 7-day rolling average of tests. And so this is the positivity rate for our COVID test, and our goal always to keep it below 10%. We'd like to get it below 5%, as we did have for some time. We're running a little bit higher positivity than 5%, but it has been level, primarily on the rolling average. Now, this is something I wanted to talk just a little bit about today because, and I know Dr. Smith will address it as well, but there's been a lot of discussion statewide about the UAMS modeling for our COVID cases and where this might put us in the fall. And they predicted that the peak time would probably be September 30th, in that time frame, that we'd reach our peak number of cases. And the peak number of cases that they're predicting is on the mean average, which is the red line, a solid red line, is about 133,000 total infections on September 30th of 2020, with over 3,300 hospitalizations. These are very, very high numbers that you see, and you can see where that would peak around October 1st, September 30th. and it would be a steady rise to then, and then a decline. Now let's go to the next slide. You can see this in terms of numbers. The peak number of infections, hospitalizations, ICU admissions, and ventilators needed in Arkansas if these projections were true. Now, if you look at September 30th, you can see that the 133,000 infections, hospitalizations, 3,300, ICU admissions, 997, ventilators that would be needed is 698. Now that is a manageable number, but we'd have to do some acquisitions and some significant shifting of resources, but we don't want it to get there. We don't want it to get there. And this is where I wanted to emphasize is that on the modeling that they do, the statistical models are predicted to continue along the current trajectory, peaking in late September, early October. And that is the current trajectory. Our goal is to change the trajectory. How do you change the trajectory? And you do it by what the Department of Health is doing so well, which is going in along with the CDC and doing massive amounts of testing. We do our contact tracing, and then we do our isolation, and we break up those strains of transmission. That is the objective, and that's what we have to do. Now, that's something the Department of Health does. What do we do as individual citizens? And that is where it comes in with discipline and social distancing and breaking those lifelong habits and courtesies that we enjoy. But if we can do that, then we make a difference in terms of that trajectory. And that's our responsibility. Everybody has a part to play. And I think that, was there one more slide here? You can see that this is the projected cases in the dark red line, and the lighter line are the actual cases. And so on that model, where we are right now is a little bit higher than what they projected. We are going to flatten that. We want to be able to reduce that so we won't reach that trajectory that they project into the fall. Dr. Smith's been a real leader. Would you come and make comments, Dr. Smith?
Thank you, Governor. I'd like to give a few more details on numbers, then talk just briefly about the predictive models and what we can do to avoid that scenario that the UAMS model paints for us. As the Governor has mentioned, we have had another 595 additional cases from yesterday. Of those, 212 were in correctional facilities. So we actually had 383 cases, new cases in the community, which is a decrease from what we've been seeing in the last few days. Our totals for cases is 16,678. Of those, 5,221 are active cases. 103 of those are in the nursing homes. 779 are in correctional facilities. And so we have 4,339 active cases in the community. The Governor's mentioned we've had a net increase of 11 hospitalized for a total of 248. We have 57 currently on a ventilator. That's an actual decrease of 4 from yesterday. Unfortunately, as the Governor mentioned, we've had 10 additional deaths, so we're at 237 deaths total. We have had 11,220 who have recovered, and that's an increase of 427 from yesterday. We have had in the correctional facilities are two areas where we're seeing increases in the number of cases is the Benton County Jail, where we have had up to this time a total of 188 cases and 13 staff who have tested positive, and then also the Ouachita Regional Correctional Institute near Malvern in Hot Springs County, and we've had 128 test positive there so far. I want to give some numbers that are more specific to our area. There's not much to report here in Baxter County because we've had relatively few cases. of our cases, we've only had one who is 65 years of age or older. That's an important age group because as a whole, those over 65 have represented over 70% of our deaths. So it's particularly important that we avoid infections in the older age group and among those who have underlying medical conditions. 60% of our cases in Baxter County have been here in Mountain Home. Now in Northwest region, where I know that Baxter County is sort of right in the middle between Northwest and the Northeast part of the state. In our public health regions, we have it lumped in with Northwest region, where we have had quite a few cases. We've had a total of 6,366 cases in the Northwest public health region. Of those, 438, or about 7%, have been among those who are 65 years of age or older. We've had about 44% have been Latino. We've had a total of 49 deaths in the Northwest region, and currently we have about 2,452 active cases. Notably, in the Northwest region, about 24% of our cases have been amongst poultry workers. Here in Baxter County, we have done a fair amount of testing, but low positivity rate. Our positivity rate for Baxter County has only been 1%. For Northwest region, though, it's been 8.7%. So 8.7% of the tests that have been done in this region have been positive. The governor mentioned our testing. We've been doing a lot of testing this month throughout the state. Yesterday we had 5,344 people, results on 5,344 people, and our total for the month is 126,120, so we have exceeded our goal of 120 for the month of June. The governor has mentioned the predictive models, and that is based on what we know about the virus, how it spreads, and the conditions as they exist now. And so it's very concerning to see that the way this virus spreads, and it can spread very quickly, could result in a large number of cases, hospitalizations, and deaths in our state. But we also have learned how to protect ourselves against COVID-19 and reduce the spread. The things I'm seeing right here are key to it. Spacing 6 feet or more apart, wearing masks when out in public. And we know that when those things are in place, along with washing hands, avoiding going out if you're symptomatic, etc., we know that we can really limit the spread of COVID-19. And even if there is someone who is infected, they won't necessarily spread COVID-19 to other people. In settings, though, where those are not occurring, where the physical distancing is not there, where people are not wearing masks, we've seen very explosive spread of COVID-19, particularly in congregate settings, but in other community settings as well. And so it's very important for us each to do our part, not only to take those measures ourselves, but also to remind one another. I get a lot of emails from people saying, well, I went to such and such a place or there, and I saw no one was wearing masks, etc. Well, my question is, what did you say to them? You know, this is, I can't be every place at one time, and we can't have public health looking over shoulders of everyone all the time, but we can all be reminders to one another, not in a way that is harassing, but in a way that helps to support our community efforts to protect one another against COVID-19. And I think that you all have done a very good job of that here in Mountain Home and in Baxter County. I want to congratulate you, but I want to say keep up the good work. There is a tendency when we don't see a lot of cases or we don't see cases amongst people that we know, that we kind of let down our guard and imagine that the danger is past, even though we see the numbers and we know that it hasn't. So I'd like to say for you all in Baxter County, keep up the good work and continue to be an example for the rest of us in this state. Thank you. With that, I'm going to turn it back over to the governor.
Thank you, Dr. Smith. With that, we'll be happy to take any questions. Yes, sir.
Yes, Governor. I'm Sonny Elliott from KTLO Radio here in Mountain Home. One of the biggest impacts in our area not due to COVID, but not because of the high numbers of illness, is because schools have been disrupted. And so our superintendent, Dr. Jake Law, is a member of your statewide committee, and he is going to convene the local committee this week. The local committees, how much say will they have in what happens, or can the Department of Education still mandate a statewide shutdown, or will we look at this on a local basis where each school district can make their own decision?
The principle that the state has set is we want to have on-site instruction next year. We also know that there's a need for a blended learning environment in which there'll be some parents that have compromised immune systems and children that they might need to do virtual learning. There might be some positive cases that you have to shift to virtual learning for a period of time, and so that's why we call it the blended learning environment. That's the roadmap that the state has provided. Within that context, there's flexibility for the schools. You know, for example, the decision if there's an outbreak and you need to close a school for a time, obviously the superintendent and the school board, you know, has that flexibility. And so we want school to happen, but the superintendents have been asked to take surveys among their constituents, the parents, and listen to them and make adjustments that are needed. So there is flexibility there. The standard is on-site instruction. Let's have as normal a school year as we can. Let's adapt as we need to because of the virus. Yes?
Do you think it's not a matter of if, but when it will come here into this area? And do you think the hospitals are well equipped here to be able to handle an influx if that were to happen, like you're seeing in Benton or Washington County?
Well, I can't predict the future, and I know that if everybody does what they should do in terms of preventing the spread, and you've got to be cautious about, you know, you have a church conference and you have people from 3 different states that come here, you lose control very quickly. And so you've got to be smart about those things. So it's really unknown as to whether the wave of the virus will come through this area in a stronger fashion. All we can do is everything that we can from an individual discipline standpoint and be prepared. And in terms of the preparation of the hospitals, they are prepared. They will need additional resources if it gets very heavy here, both in terms of testing, and that's one of the things that we talked about. As we see testing all across the United States just increase dramatically, that's a drain on the supply chain of testing, and that impacts our local hospitals as well. But I think they're working very hard to be prepared. Dr. Smith, did you want to add to that?
I think you said it quite well.
All right. Yes.
Governor, active cases have increased more than 200% since Memorial Day, and hospitalizations have more than doubled in that same period. As we start to ease into the 4th of July holiday, is the state worried about seeing a sharp increase coming out of that holiday?
Great question, and the answer is, and I do want Dr. Smith to comment on this, but you know, whenever we see increased activity in congregations or people getting together without social distancing, you can see an increase in cases, and that does have an impact on the cases that we see. And so, yes, we need to be mindful around July 4th as to how we conduct our celebrations. I know a number of cities have canceled mass celebrations for the 4th for that reason, but there'll be individual get-togethers, and you don't want to have a block party where you're shooting off fireworks and you've got everybody running around, and all of a sudden out of that block party you've got 10 cases. That's what you want to avoid. You have to be smart through that holiday. Dr. Smith?
I would agree with what the governor has said. I just would add to that, if we have learned absolutely nothing from Memorial Day, then probably we will see the same thing. I think we collectively, as a nation, as a state, have seen what can happen, and we don't want that to repeat. And I think we all know the things that we need to do to protect each other, so I hope that we don't do the same things and have the same results. Within the last 24 hours, 10 Arkansans have lost their lives. Now, I'm not pinning that on Memorial Day, but you know, we set into motion chains of transmission, and we don't know where it's going to lead ultimately, though it oftentimes does lead to an older Arkansan losing his or her life, or someone with an underlying medical condition, and then sometimes someone who's not so old and doesn't have underlying medical conditions ends up in the hospital or ends up passing away. So these are things that we don't want to see happen. So what we do, the decisions that we make individually and collectively as communities can change the future in that sense.
Do we have the capability to go remotely, Jeremy? Are there any questions remotely?
Hey, Governor, this is
Chad
Andrew Epperson from KNWA News. I'm hearing that the state legislature is planning on releasing a draft for a bill concerning hate crimes. I wanted to hear your thoughts on that and then ask if you would sign such a piece of legislation.
The answer is if the legislature passed a hate crimes bill along the lines that I've expressed support for, I would certainly sign it. Arkansas is one of, I believe, 4 states that does not have a hate crimes bill, which says that you will, if you're going to target somebody because of who they are for a criminal offense or a violent crime, then you could have an enhancement, because we don't want that kind of racial hatred and hate crime carried out in Arkansas without significant consequences. And so I would support that. I would sign it. I know that there's some legislators working on that, and I applaud them for it. Another question. I heard another question remotely.
Susanna? This is Chad Mira from Fayetteville. Looking at the estimates you showed today and comparing them to the hospitalization capacity we saw yesterday, it doesn't appear we have the capacity of ICU beds needed to meet the estimates. And then when I look at the worst case estimates, it doesn't appear we have the ventilators to meet the worst case estimates. So what's being done to make sure we're prepared for these scenarios that are being predicted here?
Well, 2 things I would mention, and that is there's a great partnership among the hospitals so that we're able to share resources. We have a good inventory, and so if there is a surge need in one area of the state, we're able to deploy those assets to there and provide additional resources. Secondly, in terms of, for example, ventilators, while if you remember back when Louisiana had their spike, we offered to give Louisiana some of our ventilators to help them through their time of emergency. Well, we have continued, even though we had a surplus, we still have a surplus, we've continued to try to acquire new ventilators into our statewide inventory. We've acquired some, we have more on order, and so we're preparing, even if it's a worst case scenario, although we certainly hope that that will be avoided. One more question remotely. I heard somebody else's voice.
Yes. Hi, Governor. This is Zuzana Sitek with KUAF. I have sort of 2 things, but they're related. We know the CDC is still in town in Northwest Arkansas. Can you provide an update on that? And do you feel like the state is doing everything it can to curb the spread of the virus in Northwest Arkansas, particularly just because that's where I am, but everywhere else that there's a spike?
I'm going to ask Dr. Smith to come and comment on the CDC in a moment, but first of all, they're very helpful to look at certain population segments there in Northwest Arkansas where we've had transmissions. They're spending a great deal of time there with their team, and we hope that that will make a difference. You know, but also I was delighted to see so many different industry and and different partners in Northwest Arkansas. While we are, as the state, we're doing contact tracing, we're doing an enormous amount of testing. All of a sudden you see the Northwest Council, you see industry as well investing in their own resources in contact tracing, in making sure they have the infrastructure to address this challenge. Knowing Northwest Arkansas, they're innovative. They're not going to let this get them down. They're going to put additional resources in addition to what we're doing. Is the state doing everything that we can? We're doing everything that we can every hour. If there's some stone that's unturned or some additional action that should be taken, we'll look for ways to accomplish that. Dr. Smith?
Thank you. With regard to the CDC team in Northwest Arkansas, as the governor's mentioned, they are spending a longer period of time here than would be typical. Typically, we'll have a CDC team come for about a week. They're doing a deeper dive, which is exactly what we've asked them to do. Some of the activities that they have planned for today is they are actually doing a deeper analysis to look at those chains of transmission amongst households. That's something that's very detailed and challenging for us to do. They're taking a deeper dive there. They are also scheduling different focus groups to get a better idea about what different groups within the community, what their thinking is and how they could be most effectively reached with messages to prevent the spread of COVID-19. They are doing some deeper analyses from our Marshallese population, just as they've done with our Latino population. And they're developing plans for testing and also even getting down to particular apartment complexes, et cetera, where the testing could make an impact in terms of identifying chains of transmission to be able to interrupt those. And they're also, of course, continuing to work with our poultry industry there to analyze data. These are some of the activities that they're planning just for today, and each day is mapped out, and they will use all their analyses and all their data from working with those communities to give us good guidance to take us forward as we try to reduce the spread of COVID-19 in the northwest part of the state.
Are there any other questions?
Sorry, I have one more. I apologize. So I know the CDC is there looking at the Latino and the Marshallese communities. Any thoughts from the state on what factors are contributing to the community spread otherwise in the region, not just in those communities, but sort of generally speaking?
Well, I mean, of course, you've had a challenge with the Benton County Jail. That's not community, but it impacts the community. It can. And so, you know, what I see is that you've got all across the state of Arkansas some community growth in cases, and then in Northwest Arkansas you've got an additional layer that's connected to the language barrier populations, the ones that we're trying to utilize CDC resources to address, and the food processing industry. And so that is really where I see the added growth there in Northwest Arkansas.
Thank you.
With that, thank you all. It is great to be here I'm sorry, there was a question back here. Yes, sir, you did have a question.
Yeah, we all agree. Yeah, coronavirus came from China. Whether it came from the lab or the meat factory, doesn't matter. It wasn't contained as well as it should have. And it was let go across.
So you have a question?
Yeah, it was let go across the entire world. Should Arkansas stop doing business with China just for the remembrance of the people that have died from COVID alone?
And the answer is no. I think that we have to move production of medical supplies from China to the United States. We don't want to be dependent for our supply chain in PPE and other medical supplies on a foreign source. But whenever you look at other levels of commerce, you don't want to isolate the United States from the second leading economy in the world. And so you got to make individualized judgments in reference to China. You know, they repress freedom. They do not respect intellectual property rights, but we've got to work within that framework, try to change those things, and not make them an enemy whenever it's not necessary to make them an enemy. Let's deal smart